Hello, and my name is Rochelle Nicole Swartz. This is for health communication. My communication program was about stroke and getting community awareness. So I do work at Hutchinson Regional Healthcare Center in Hutchinson, Kansas. It is a hospital, and I work in the quality department with the stroke program. Um, so one of the things that we're continuously trying to do in a real world situation is do more stroke outreach to the community. And that is something that we do performance improvement upon. This is a pretty recent, it was in March, a community event that members of our staff did with us at a community health fair to do stroke awareness. You can see up in the back, there's a banner with the Be Fast on it. One of the things that we had to decide recently was to go with Be Fast or to change it back to Fast because the American Heart Association recently changed their material back to Fast. Research showed that Fast was easier for people to remember as an acronym instead of Be Fast. And Fast stands for face, arm, smile, and time. So those are some simple indicators as to whether or not you can tell if you're having a stroke or if someone else has or is. They added in the B, which the B stands for balance and the E stands for eyesight. So be fast. The stroke program in a hospital setting does not necessarily answer just to itself. There's the core stroke team, and then you have them reporting up to the stroke task force, which involves all the departments that interact on a stroke call or when stroke protocols are put into place. And then they go up through two different waves. One side is the process improvement side and the quality side with the QAPI and board quality. And then the other side is the medical clinical side with the professional practice committee and the medical executive committee. And then the board of directors ultimately signs off on all changes and approvals. So one of the things that we do per the Joint Commission is we have to do patient satisfaction surveys. We had noticed that our patient education was lacking, so per our patient satisfaction surveys, and so we created a PDSA, which is a way to implement a project and get to continuous improvement throughout it. We had patients saying that they weren't receiving their discharge education for stroke and personal risk factors because sometimes a stroke is not the only stroke. And having a stroke puts you even more at risk for another stroke. And so we compared our materials to St. Francis in Wichita and met with marketing to show what our previous material was and the vision for the future booklet. So then we created this booklet, and then we saw, as you can see, over the course of a year, starting in Q1 of 2024, we slowly reached 100% on patients receiving stroke satisfaction or stroke education from the patient satisfaction. So one thing that I piloted with this, knowing that pamphlets and information are beneficial and utilized well for our community, was to expand the stroke education into schools. This is an example of our patient education booklet, and this is a page on the inside, and that talks about medications and side effects and what to do if you're having patient or if you're having symptoms. So I created a flyer that's basically pretty easy. Somebody in elementary school all the way to high school should have an easy time reading it. They may not understand it, they can definitely ask questions. The main things to take away from this are to call 911 immediately, notice the time that you notice the person acting differently, and then get a list of all of their medications um, to make sure that we can have all that information to help the physician be able to do adequate care. And then on the other side, There's lots of different stroke awareness materials that are available for free to the public. So we put on the BFAST, the balance, eyes, face, arms of speech, and time. So I didn't really get feedback because of my own health issues, but wanting to do more than just a paper, we also had the opportunity at Career Quest Day to interact with all the sixth graders from the Reno County area. The sixth graders were split into groups of two. There was a morning group and an afternoon group, and then those groups split into another two. So one half of that went to Hutchinson Clinic, and one half of that stayed at Hutchinson Hospital. So roughly half of the sixth graders in Reno County received some sort of stroke-related education as an example of patient care by our caregivers. There were many different opportunities across our campus for jobs, from cafeteria worker all the way to radiology, and many different areas of our patient care do interact with stroke patients in some sort of way. So it was easy to give examples from radiology to the EMS to everything. One of the reasons that we find it so important is there's many grandparents that watch children after school. There's many older adults that volunteer at the community schools. And then also knowing what to do can change a life, because a lot of times people don't even necessarily consider the fact that they're in a risk group for a health condition. So as long as other people can recognize the signs and symptoms, then time is brain. Our program opportunities for improvement. We can incorporate some more social determinants of health data into our program data analysis. So for instance, I don't know necessarily what that looks like yet, but we're doing a community health awareness survey right now, and we're looking at things like transportation and different barriers and challenges for just healthcare overall. And so knowing that, maybe we can partner and get some more education in there. We can increase the emergency department provider support for community activities. It's really hard to get providers involved with community outreach because they are so busy and they see people enough on their own time. So when it comes to stroke, though, typically the emergency department is the first major players in the game for tracking the times and making sure that everything happens in the sequence of events that it needs to occur. Also increasing the community health awareness, not just education at school for stroke, but also having this set, receiving information on stroke, and possibly using that to launch other school health educations. Um, Diabetes, we all know that nutrition is something that is focused on at a younger age so that kids can make healthier choices, but also understanding what those choices can look like when they're older. Um, and then also maybe using some of that to springboard parents into healthier choices as well. Um, Not to mention the, cessation of smoking and things like that. It would be more along those lines. And also implement a community stroke support group. Um, Sometimes people, after they've had a stroke, they aren't the same. They don't act the same, and may not quite look the same. And so, being able to have support groups, not just for the victims of the stroke, but also the family members of the stroke victim, and then that way, other people can survive. Um, for example, if a child has a mom or a grandmother who has had a stroke and they're not quite the same as every other mom or grandma, it would be nice for them to be able to bond and meet with other children who understand what that is like. So, these are all of my references. I would like to thank you for this time and opportunity, and know that communications like this are always continuous improvement. They are always learning from what went right, what went wrong. And I think that this was really a great opportunity that is a real world situation. So thank you.